Hello, Ms. Gomez. My name is Jonathan. I'm gonna be your online nurse today. The reason we're on video call that I understand is because it seems that you gave birth yesterday. However, you felt that
Mm-hmm.
you didn't receive proper education. Is that correct?
Yeah, I feel like I don't know enough as much shit.
Okay, yeah, that's totally fine. I'm gonna try to answer any questions, so hopefully you'll feel more prepared. Okay?
Okay.
Yeah, do you have any questions?
I have a few written down.
Okay.
Well, my first question will be about my son, his belly button.
Uh-huh.
You can't see it here, but his umbilical cord just is looking very like weird, and I don't know how to take care of it or how to deal with it.
Okay, yeah, that's a very common concern among new parents. The umbilical cord can look pretty crazy. So at the
Mm,
hospital, we clamped it and we cut it, and so it can look a little long right now. A few points of education on that would be that it will fall off naturally, so it will look like your own belly button in about a week, um, 1 to 3 weeks. So don't worry about that. Whenever you do diaper changes, make sure to fold the diaper under it because you don't want to get
mm-hmm.
any poop or pee on the umbilical cord itself. Keep it clean. Definitely, if you get like anything on it, just wipe it down gently with warm soap and water. Don't try to clean it with any harsh chemicals. And yeah, any more questions about the umbilical cord?
I think I'm good on that one.
You're good on that one. Okay.
Yeah. I was also wondering I'm wondering how to take care of me also, because that's more, I mean, that's also important. But I'm wondering, like, I don't know if I am getting an infection.
Okay, yeah, that's a common concern too. If you could share with me, did you have any lacerations or any tearing during the birth?
Luckily, not.
Nothing. Okay, that's perfect because that's one of the things we would be concerned about for infection. Another one we would be concerned about would be such as if you had uterine atony, which is when your uterus doesn't want to, like its muscle tone doesn't come back, so it's like soft, and there's
Mm,
still that could mean there's blood inside, and that could lead to an infection. But your nurse told you everything seemed okay, right?
yeah.
Okay, yeah, that's what I was seeing. So that's perfect. So for you, you are in a pretty good position. I wouldn't really be too concerned about infection, but that's always a possibility. So what we're going to be looking for is any redness, swelling, any foul smelling drainage, any drainage that's a weird color. Any you could check your own temperature. If you have a high temperature, that's always a sign of infection. Do you have any more questions about that?
No, I feel pretty good. I'll touch you right here. I feel good.
Okay, yeah, that's great. Any other questions?
I'll, what?
Any other questions?
Oh, yeah. Um, so I have my kid right here, the new junior, and I was wondering, like, I've been seeing on TikTok stuff about shaking the baby's head is bad, and I'm wondering what's good about that.
Yeah, so if you're referring to shaken baby syndrome, I'll go ahead and send you an article by the Mayo Clinic regarding
Okay.
shaken baby syndrome because I know that's a big concern for many new time parents just because that's a topic that we see in the news, on TV shows, and it can be pretty scary.
TikTok.
Yeah, so I sent you a news article, so if you could check your email, and it'll just give you the rundown. But basically, it's where, unfortunately, some parents shake their babies very aggressively, which leads to the
Hmm.
baby's brain being damaged. Um, so luckily, in that article, it does say that doing something such as bouncing the baby on your knee won't give it that condition. So, be gentle, but don't be too scared to handle the baby. Um,
Yeah.
if you are concerned about that, some signs would include things like if the baby fell into a coma, if the baby's hard to wake, um, and if they're having seizures.
Sorry, my baby. I'll be back. I'll be back. Okay, I'm back. Sorry, but
Okay, any other
okay.
questions?
Yeah, I had a few more.
Yeah.
More. so my nurse was talking about something like thermal regulation, but I was kind of out of it, so I was wondering if you could explain what's something like that.
Yeah, so thermoregulation in regards to infants is just relating to the fact that babies have a hard time staying warm. They're really small, they can't move much, and they have less amounts of fat than we do. So it's hard for them to keep warm, which is where we want to help them. So a good way to tell if your baby is cold is if they're shivering, or a good way to test is to just poke an extremity or poke their chest softly. And if it's cold, if they're cold to the touch, then that's a good sign that they're probably too cold. So a good way to manage that is you could put mittens on them, you could put a hat on them, you could put a shirt on them, or put them skin to skin.
Okay, that
Yeah.
makes sense.
Oh.
Um, Also, one thing I did notice was that when Junior was born, he looks a little yellow and he's still a little yellow. That feels kind of weird.
Yeah, so that's just called newborn jaundice. That's a very common thing. It's just due to the fact that in the uterus, or yeah, in the uterus, their liver isn't completely
Mature?
yeah, it's not completely mature yet.
Mm-hmm.
So, which is totally fine. And the liver is what breaks down that thing called bilirubin, and that's what makes them yellow. So as the infant grows up or matures, the liver will mature quickly. So it'll start breaking down that yellow color. So everything is okay. If you want to help accelerate getting rid of that bilirubin, you can put the baby next to a window to get some sunlight, but make sure it's not direct sunlight because their skin is pretty fragile. So, just put them next to a window, or you could also try feeding them because bilirubin is also excreted in the stool.
Okay. I only have two more questions for you.
Okay.
So, I did get Junior circumcised, and I don't know if it looks normal because it just looks very red. And
Okay.
I don't know if that means it hurts because I don't know.
Okay. Yeah, that's a very common concern. So after circumcision, it is normal for it to like cherry red for a little bit, and that's totally fine. A few points of education regarding that would be to make sure to keep the area clean, but don't use any abrasive wipes. They use water, warm water, and soap to clean that area. Make sure it's clean of any stool or any urine. Also, another good thing to keep in mind is that whenever you're changing them and putting a new diaper on, put petroleum jelly on the penis and the diaper itself, so that way it doesn't stick together. Because that's one thing we want to avoid for sure.
Mm. And what about any drops of blood?
Yeah, so a little bit of bleeding is fine, but if you see anything bigger than a dime size amount of blood in the diaper, then that's something that I would call the provider for, because that probably means it's not healing the way we want it to.
Oh, and that takes
It should be
how
about a
long?
week.
Okay,
Yeah.
that's really make sure.
Yep.
I've only had a baby like 2 days.
Mhm.
Oh no, this a week now.
A day.
I don't know. I'm not keeping track of time anymore.
Yeah, that's pretty.
But
That's okay.
my last question would be infection or I guess like a cold. Like how can I tell if a kid's having a cold? Because
Yeah, so it can be pretty hard to tell if a baby's sick because they can't exactly tell you how they're feeling. But good ways, one of the best ways to test for infection is to do a rectal temperature. The nurse taught you how to do that, right? Yeah. Okay. So yeah, that's always a good way. If it's above 100.4, that means that there might be an infection, which means that it's probably time to call the provider. You could also, if you see any signs that you would assume that you were sick, such as like respiratory, having trouble breathing, any signs that you would see in yourself, then that's usually a sign of infection.
okay. And is the cold for me the same if like less severe than it would be in a kid? Or is it?
Well, we want to keep in mind that a baby's immune system is not completely mature. So,
Mm,
if you do see that your baby does get sick, I would say that's something you definitely want to call the provider about just because their immune system is not very strong yet. But yeah,
Okay.
yeah. Any other questions?
I think that's all for now. I might call again later just in case, but for now
Okay.
I'm good.
Okay. I hope I was able to help.
Mm-hmm.